To perform CPR on an adult, we must first of all ensure the area is safe. Having done so, we should then try and get a response from the casualty. Shout at them, try and use their name, but if they don't respond to this, then shake the shoulders to try and rouse the casualty. As there's been no response, we must now check the airway. Look inside the casualty's mouth for any obvious obstructions such as vomit. And in this case, as there are none, we now move on to opening the airway to move the tongue out of the way. We do this using a method called head tilt chin lift. With the airway now open, the casualty should be able to breathe, so we assess for breathing for up to a maximum of 10 seconds. Look for signs of movement in the chest and abdomen, listen for sounds of breathing, and if you're close enough you may be able to feel the casualty breathe against you. As there are no signs of breathing, we must call for assistance straight away. Ideally get someone else to do this, but if you're alone with the casualty you must call for help now. We now move on to starting CPR. The first part of this is to make circulation. Move to the casualty's chest, place one of your hands in the centre of their chest over their breastbone, place the other hand on top, straighten your arms and try and lean over the top of the casualty so you can use your own body weight. Squash the chest approximately a third of its original size. Releasing the pressure will make one compression, and we do this a total of 30 times in rapid succession. Following these compressions, we now need to breathe for the casualty. Move back to the head, ensure the airway is open and squeeze off the nostrils. We then take a normal breath, cover the casualty's mouth with our mouth and blow gently into them until the chest visibly moves. Moving away will allow the casualty to breathe out, and then we will repeat this procedure to get a total of 2 ventilations. We return to the chest and perform a further 30 compressions to move the blood and oxygen round. After our 30 compressions, we now return to their airway, make sure it's open and give them 2 further breaths. And we will continue this routine of 30 compressions to 2 ventilation until help arrives and takes over, or until we're physically exhausted and unable to continue.